Haematuria. Haematuria refers to the presence of blood in the urine. It may be macroscopic, visible/gross, urine is visibly discolored; microscopic, non-visible, blood is only detectable on urinalysis. Haematuria is a clinical sign rather than a diagnosis and can be due to a wide range of urological or nephrological conditions. The underlying cause must always be investigated. Peak incidence. Haematuria can occur at any age. In children, common causes include urinary tract infection and Henoch-Schönlein purpura. In younger adults, causes include UTI, renal stones, or glomerular disease. In older adults, urinary tract malignancy, particularly bladder cancer, must always be considered. Symptoms: red or brown discoloration of the urine, invisible haematuria. It is often painless, but pain may occur with renal colic or infection. Symptoms of anemia: fatigue, dizziness, and palpitations if prolonged or heavy. Symptoms of underlying pathology, for example dysuria and frequency in UTI, flank pain in renal stones, and weight loss, night sweats, or mass in malignancy. Signs: visible haematuria, urinalysis positive for blood, clinical features of anemia, pallor or tachycardia, and findings suggestive of an underlying cause, for example fever in UTI and palpable mass in malignancy. Causes: urological causes, urinary tract infection, malignancy, bladder, kidney, prostate, ureter, renal or ureteric stones, benign prostatic hyperplasia, and trauma, including catheter-related. Renal or glomerular causes: IgA nephropathy, post-infectious glomerulonephritis, thin basement membrane nephropathy, and other nephritides, for example lupus nephritis. Haematuria mimics non-pathological causes: menstruation, recent vigorous exercise, recent sexual activity, foods, for example beetroot and rhubarb, and medications, for example rifampicin, doxorubicin, and phenazopyridine. Diagnosis: investigation should follow a structured approach to identify the underlying cause. History: duration, associated symptoms like pain, dysuria, and systemic symptoms, risk factors, for example smoking, occupational exposures, and anticoagulant and antiplatelets use. Urinalysis: confirm haematuria. Look for proteinuria, leukocytes, or nitrites suggesting infection. Red cell cast suggests glomerular disease. Urine culture if infection is suspected. Blood tests: full blood count, renal function, and coagulation screen. Imaging: ultrasound or CT urogram to assess for stones, tumours, or structural abnormalities. Cystoscopy: this is essential in adults with unexplained visible haematuria or non-visible haematuria with risk factors for malignancy. Renal referral: if features suggest glomerular disease, for example proteinuria, red cell casts, hypertension, and renal impairment. Complications: complications depend on the underlying cause but may include anemia, progressive renal disease if underlying nephropathy is missed, and undiagnosed malignancy with late presentation. Management: Management depends on the cause identified. Urinary tract infections, antibiotics as per the local guidelines, renal stones, analgesia, hydration, and urological intervention if obstructive, malignancy, urological referral for further management, for example surgery, intravesical therapy, and systemic treatment, glomerular disease, nephrology referral for further workup and disease-specific treatment, anticoagulants-related hematuria. Review anticoagulation dose and indication, but do not automatically stop therapy without specialist input. All cases of visible hematuria in adults and persistent non-visible hematuria with risk factors warrant urgent urological evaluation to exclude malignancy. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today